Hello, everybody. Andy Jacob here with the DotCom magazine Entrepreneur Spotlight Series. I have a very important show today. I've been waiting for this show for a number of weeks. And, we talk about at DotCom magazine, everything that's going on in the world today. And one thing that's so important and one thing that we're talking about all the time is pain. When we think about it, the world that we live in, medicine really is so important. And we came across a real worldwide leading expert in the field of diagnostics. His name is Dr. Nelson Hendler. When we saw what he was doing at Mensana Clinic Diagnostics, LLC, we said to ourselves, we need to get Dr. Hendler on the show. He has a diagnostic test, actually 3 diagnostic tests that are just incredible. And if you are a person that likes medicine, likes learning about ways in which we're improving our life, ways in which we're improving the diagnostic area of medicine, this is a interview that you have to listen to, because what Dr. Hendler has done with his associates is absolutely remarkable. Dr. Hendler, it's an honor to have you on the show. Welcome to the DotCom magazine Entrepreneur Spotlight Series today.
Oh, thank you for having me. I really appreciate it.
Yeah, it's great to have you on the show. Of course, we've spoke prior to the interview. I actually went on and started the diagnostic test myself because I do get headaches once in a while. But let's talk about it. Let's pull the lens back, Dr. Hendler, to 30,000 feet. Tell us what you do, and then we're going to get into it.
Okay. The test we have provide an accurate diagnosis with a 96% correlation with diagnoses of Johns Hopkins Hospital doctors.
Yeah, this is unbelievable. You have a test that people can go online, and it has a 96% correlation with diagnoses at Johns Hopkins Hospital with their doctors. It's basically like getting a visit to the Johns Hopkins Hospital just by going online. We talk about pain. We talk about headaches. A lot of entrepreneurs get them. We're so busy in our day. At the end of the day, sometimes we get a little headache, or, sometimes it's just a tension headache. Sometimes, unfortunately, it's something much deeper. How many people in the world, have chronic pain and headaches that we've been able to identify?
A lot of the market research shows that 20% of any population in any highly developed country, Japan, Europe, et cetera, United States, 20% has some sort of chronic pain problem.
Yeah.
So in the United States, that'd be 66 million people.
That's incredible. It's so interesting, of course, Dr. Hendler. And when we spoke prior to the show, we started talking about it. There's a lot of misdiagnosis. There's a lot of people that go into the doctor's office, and doctors are great. We love our doctors. They're incredible. But sometimes people get misdiagnosed. Let's talk about it. If you don't get an accurate diagnosis, then you really have a problem, right? So how important is accurate diagnosis, and what does your test do to help with that sort of situation?
Okay. Our research from Johns Hopkins Hospital showed that 40% to 80% of chronic pain patients, headache patients, and back pain patients and neck pain patients, 40 to 80% are misdiagnosed.
That's unbelievable when you think about it, Nelson. I cut you off there, and I know you wanted to expound on that. But when we really think about it, for the people watching the show, think about that. The research from Johns Hopkins Hospital shows that 40 to 80% of chronic pain and headache patients are misdiagnosed. This is incredible. How do we know they're misdiagnosed?
They're not getting well. If they were correctly diagnosed, to be properly treated, and they get well.
Yeah, it's so interesting, Dr. Hendler, because obviously they're not getting well, and people spend so much time, energy, and effort dealing with their pain, whether it's their head pain or their body pain or their aches and pains, and we look at it. And doctors are so busy these days. You go into a doctor's office, you get shuffled through oftentimes. Many times they don't have a lot of time to spend with you because they just have such a workload. So is this the main reason why patients are diagnosed? Let's expound on that a little bit.
Sure. The medical literature reports that the average physician spends 11 minutes interviewing a patient, during which time he speaks 8 of the 11 minutes and interrupts the patient after the first 36 seconds. You can't get a careful history doing that. You need to spend an hour with the patient. And the leading cause of misdiagnosis is, number one, the doctors don't spend enough time with the patient. And because they have the wrong diagnosis, number two, they order the wrong test.
That's unbelievable. I mean, you think about it, all the millions and billions of dollars spent on healthcare, and here we have the wrong tests being ordered, and they're not maybe ordering the right tests. And let's talk about it, because do these tests oftentimes miss the thing that's the problem? I mean, let's talk about that in layman's terms, because I want to break it down with you.
I'll make it really simple for you. Lots of articles in the literature report that the MRI misses damaged discs, misses herniated discs, misses disc disease 78% of the time, 78% of the time compared to a provocative discogram. A CAT scan misses bony pathology 56% of the time compared to a 3D CAT scan. And an X-ray misses pathology 98% of the time compared to flexion extension X-rays with obliques and odontoid views.
Well, Dr. Hendler, that's remarkable. And I would imagine that the misdiagnosis comes back, and then the treatment has to happen. And sometimes, or oftentimes, according to these statistics, they're providing a treatment or some type of pain medication or some type of medication that perhaps is not the right solution, which is why these people aren't getting better. Is that the way it works?
Unfortunately, doctors wind up treating laboratory tests instead of treating patients.
Yeah.
And the most essential part of establishing a diagnosis is getting a careful history. Now, let me give you an example. If I came into your office, you're a doctor, and I came in and I said, I have pain in my thumb, and you as the doctor order an X-ray and you find a vice on my thumb, the solution is quite obvious. You would recommend a vicectomy. I'm sorry, I couldn't resist that one.
Yeah.
But if I came into your office and complained of pain in my thumb and you got an X-ray and the X-ray was normal, you would say, I don't know why you have pain in your thumb. What's missing from there is the careful history. The doctor should then say, well, when does your pain in the thumb get worse and when does it get better? And the answer is, geez, when I hit my thumb with a hammer, I get pain in my thumb. And when I stop hitting it, the pain goes away. And that, I know it's a simple-minded explanation, but that emphasizes the importance of a careful history.
Yeah, it's so important. Yeah, it makes sense because they're only spending a few minutes per patient. They really can't get into a thoughtful, careful history. And let's talk about that a little bit, because in your system, in your program, on your platform, on your tests, you're asking questions about what's going on in this person's life, and then you're able to produce a diagnosis. So let's talk about that, because the doctors aren't really spending enough time to do the thorough, careful history, which is what your system and your program platform and tests can do, or questionnaires can do, correct?
That's correct. If a doctor spent time evaluating a patient and asking all of the proper questions, they could establish a diagnosis which was more accurate than the MRI, CAT scan, and X-rays. And the literature is filled with reports saying that the history is the most important thing. So our test asks, on the pain diagnostic test, asks 72 questions with 2,008 possible answers. And it takes a patient anywhere between 30 minutes to 60 minutes to complete the test, the questionnaire. So let me ask you a question. When was the last time a doctor spent an hour with you?
It's never happened. I mean, and that's exactly right? I mean, that's so interesting. So what we're gathering here is that this testing, this very careful testing, let's talk about it just for a minute before we get into it. I mean, the testing had to come from somewhere. I know that it was developed by a team of physicians at Johns Hopkins Hospital, one of the best hospitals in the world. How did this whole testing protocol occur? How many charts did they review? How long did it take to come up with this system and testing that you put together?
I reviewed 10,000 charts over a 17-year period of time. And it was a matter of pattern recognition. You looked at what symptoms the patient had, and then I looked at what diagnosis the doctor gave, and I looked at what results were evident on the medical testing. So we retrospectively derived the questions and prospectively were able to predict the diagnosis and the appropriate medical test to use. And it's been, this is all published, by the way, in the medical literature.
Yeah, it's very interesting. You sent me over some of these letters that you've received from so many high-level, famous people actually saying, "Hey, Dr. Hendler, we've used the test. We've taken the test. We've documented that our patients have gotten rid of their pain once we've been able to diagnose their problem, and people that actually are living pain-free also reach out to you all the time." Let's talk about it, because you're very big into publishing articles as well. You're very well known throughout the world as this leader in the space, Dr. Hendler. How important is it in your mind that these tests accurately portray what's happening, so that then what happens is it reduces the reliance on pills and tranquilizers and things like that?
Well, let's start with a very simple-minded explanation. What does it take to fix a flat tire?
It takes air.
Well, you don't know what's wrong with the tire. Until you know what's wrong with the tire, you can't make the proper repair to the tire.
Yes,
and
right.
You could have a leaky valve stem, or a cut sidewall, or a nail in the tread, or the tire lost its bead on the wheel. And until you establish the diagnosis, you can't repair the tire so it works. Now, there's another component there. You could have one or two or all three or even four things wrong with the tire. And until you establish the diagnosis, suppose you fix only one thing wrong with the tire, and it's a nail in the tread and a leaky valve stem, and you fix just the nail in the tread, guess what? You're still going to have a flat tire. So you have to establish a diagnosis and take into account that a patient can have multiple diagnoses. Until you consider all the diagnoses, you can't get the correct testing and you can't get the proper treatment.
Yeah, that's so interesting, of course, for so many people with pain throughout the world and so many people that have headaches. Let's talk about it, because who wants the test? I mean, everybody needs the test, I would think, that's going to the doctor, but who's the people that are coming to take the test? Are they being sent by attorneys? Are they being sent by their hospitals? Are they being sent by their doctors? Or are they saying to themselves, I want to take care of my own healthcare and take charge of my own healthcare. Therefore, I'm going to go take the pain validity test or one of the headache tests that you have, or one of the other tests that you have, the pain diagnostic test.
The answer to your question is yes. All of the above, right?
Yeah.
I'll give you an example. A patient gets injured in an auto accident. His doctor, the patient's doctor, gets an MRI, CAT scan, and X-ray. They're all normal. And then the doctor says, I don't know what's wrong with you. Nothing showed up on testing. You must have cervical sprain or whiplash. And the patient says, what can you do for me? And the doctor says, nothing. Now, without a proper diagnosis, without getting a provocative discogram, flexion extension X-rays, facet blocks, root blocks, 3D CAT scans, the patient doesn't have an accurate diagnosis. And then the doctor sends the report to the attorney. And the attorney says, whiplash. The doctor then sends the report to the insurance carrier, who says, soft tissue injury with no objective medical findings, $3,500. Get out of here. Now, the patient hasn't gotten better. Even if after they got the money, they still haven't gotten better. So those are the kind of people who might want to take the pain diagnostic test or the headache diagnostic test to find out what's wrong. On the other hand, the insurance company may say, the patient's faking and malingering. Then the attorney may say, well, go take the pain validity test. And the pain validity test predicts with 95% accuracy who will have abnormalities on the correct objective medical test. And this test has always been admitted in court in 9 different states. So the answer is the patient who's not getting well, the attorney who really wants to help his client, the physician who really wants to help his patient. So the answer to your question is all of the above.
Yes, that's great. The answer was yes. Pain diagnostic, pain validity, headache diagnostic testing. Let's talk about it a little bit because, I mean, we can get deep into this. You're going to go way over the heads over, most of the people watching the show. But I want to talk a little bit about really the bottom line, because I know you're a very caring person. I know you're a physician. I know you've got an incredible, background. The bottom line to all this is you want people to relieve their pain. I mean, you care about people. So let's talk about that and why that's so important to you as a person and as a medical doctor.
Well, I think when you examine what happens to someone with chronic pain, they go through 4 stages that resemble Kubler-Ross's stages of death and dying, which is 5 stages actually. So the first stage, they expect to get well. That lasts about 3 months. And then after 3 months, they say, wow, I'm not getting well. What's going on? So then they start getting anxious and worried about their pain. And by the 6th month, they get depressed. And that depression may last 6 months to 3 years. And then after about 3 years, they start adapting to their new level of functioning, which is less than what it used to be. The trouble is, not only do chronic pain patients get depressed, they commit suicide. They commit suicide at a 3 times higher rate than the general population. And that's some research from Dr. Fishbane, University of Miami. So it breaks my heart to see these people who otherwise could be treated are being discarded in the wastepaper basket of misdiagnosis. And I'm sure you saw the most recent article. Not only did they get depressed, they get angry about the guy in the Midwest who went out and shot the surgeon because he operated on him and didn't get well. So, chronic pain can really mess you up.
Yeah, Dr. Hendler, you're exactly right. And of course, for the geeks out there that are watching the show, we call them geeks, technophiles, people that love technology. There's this platform, Dr. Hendler, that you've put together, and you've assembled, 72 questions with 2008 possible answers that really gives the diagnosis with a 96% correlation with the diagnosis of Johns Hopkins Hospital doctors. So some people might be saying to themselves, I mean, who put the 2008 possible answers together, and how did it all sort of come together so that it matches the correlation so well?
Okay, well, I'm going to lapse into some geek talk for you. The questions and answers were retrospectively derived and prospectively added to the questionnaire, and they were validated both retrospectively and prospectively over a long period of time. And then the answer to the questions are scored using Bayesian analysis. Now, Bayesian analysis is experiential, and that's different than Boolean logic. Boolean logic is what computer programmers use, on, off, yes, no, etc. Bayesian logic is experiential. Let's give you an example. I love the old flat tire again. You come out and you look at the car, and using Boolean logic, you would say, is the tire flat? Yes, no. Okay, if no, drive away. If yes, is there a leaky valve stem? Yes, no. If no, is there a nail in the tread? Yes, no. And you see with this branching diagram, each juncture point has a 50-50 chance. It's 0s and 1, yes or no. It's a branching diagram. It fails because, number 1, you only have a 50-50 chance each time. And number 2, it makes no provision for multiple answers and multiple diagnoses. Now, using Bayesian logic, which is what you use on a daily basis, you come out and you look at the car, you say, oh, I got a flat tire. Oh, I've had 21 flat tires in my lifetime. 18 have been due to a nail in the tread. Therefore, my most logical, most highest yield result will be to look for a nail in the tread. But 2 of them have been due to a leaky valve stem. Aha. So even if I fix the nail in the tread and the tire is still flat, I got to go check the valve stem. So that's the difference between Boolean logic and Bayesian analysis. So we tallied up the number of diagnoses. Each symptom has multiple potential causes, multiple clinical manifestations. So a single symptom may be caused by 3 or 4 or 5 different things, and we take them into account, but we rank order. It's most likely this symptom, next most likely this symptom, next most, and that's how we derive the diagnostic paradigm and the headache diagnostic test.
I love it. I mean, for the people watching the show, if you want to learn about Bayesian logic, here you go. Rewind what Dr. Hendler just said. I mean, that's really remarkable. Very interesting. Very, very, very interesting.
One more geeky statement. I just recently published an article about the flaws with artificial intelligence in medical diagnosis. Look what happens. Everybody says, we're going to review 1 million charts and we're going to come up with this artificial intelligence program. Well, if you have 40 to 80% of the patients who are misdiagnosed, and you have medical tests who miss the diagnosis 56 to 98% of the time, you have a multiplicative course of error, and you have nothing but GEICO. You're going to get nothing but garbage in and garbage out. So doing massive chart reviews, no matter how large the sample is, if the information you're putting into the sample is erroneous, you're going to get erroneous answers.
Wow, that's fascinating. I mean, that is really interesting for people involved with AI and looking at AI as a solution to a problem. I mean, if you start with something that's not correct to begin with and you start analyzing it with an outcome, your outcome is going to be terrible, right?
What a surprise.
What a surprise. Listen, Dr. Hendler, I love speaking to you. I'm going to bring you back on the show. But before I let you go, listen, I want to talk about entrepreneurship. But before we do, I want to talk about your journey. You know, you've got a fascinating sort of evolution of your own career. I mean, you've done so many great things. You've published so many articles. You now have, the pain diagnostic tool, the pain validity test, and the headache diagnostic test as well. I mean, let's talk about it. When you started in medical school, did you think back then that you would be sort of become this expert in trying to diagnose people in a valid way with the tools that you put together? In other words, was that your passion back when you started, or did this evolve through your career?
It was an evolutionary process. Actually, when I went to Princeton, I started out as an engineer. And slowly but surely became more and more interested in psychology and majored in psychology, graduated cum laude from Princeton. But I also played varsity lacrosse. I wasn't just a geek. Then when I went to medical school, I also got a graduate degree in neurophysiology as well as medicine. And that was at University of Maryland. And then I went to Hopkins for my residency in psychiatry. And the chairman of neurosurgery needed the psychiatrist to work at the pain treatment center. And I started working there. And what happened is that they were referring patients to me saying, I operated on this patient. He didn't get well. He must be a head case. Send him to the shrink. And I'd be talking to these patients. And I found out, well, there was nothing wrong with them psychologically. The reason they were depressed was they'd had surgery and they hadn't gotten well. It was a normal response to chronic pain. So the boards in psychiatry are 2/3 psychiatry, 1 part neurology. So I started doing neurological evaluations on the patients, and I found many of them were misdiagnosed. Many of them never had the correct test. And then I looked at the medical literature, and it was filled with garbage. I mean, talking about garbage in and garbage out. They started using MMPIs, Minnesota Multiphasic Personality Inventories, to predict whether or not someone's pain was valid. Well, that's like trying to repair a carburetor using a tire gauge. psychological problems and medical problems exist on two independent axes. And I always told them, hysterics get this disease and schizophrenics get brain tumors, and having a psychological problem does not confer upon you an immunity against getting a medical disease.
Yeah.
And that's why I started developing what I did.
Yeah, so interesting, Dr. Hendler. I want to talk to you a little bit more. I know I'm going to keep you over time here, but I was so excited to have you on the show. Let's talk about this now, because someone goes in, they get misdiagnosed. Then perhaps they get put on some painkillers or some medication. And, with your psychological background, I would imagine, and I'm very interested in the answer, is when someone gets on all these painkillers and they get placed on all this medication, I would imagine that really can do a real injustice to their brain and their outlook and their feelings and their emotions. So let's talk about that connection, because I think when I look at it, your validity tests and diagnostic tests and headache diagnostic tests, because they're so accurate, could stop a person from getting on those meds perhaps and then changing their entire brain chemistry, right?
Well, it's a little bit more than that. In the neurosurgery textbooks from Duke, UCLA, Hopkins, University of Texas, I wrote the chapters on the pharmacology of pain. I've testified before the U.S. Senate on 3 different occasions on medical problems in front of Ted Kennedy about the abuses of Valium and a few other things. And here's where the problem arises. The average doctor treats chronic pain like acute pain. And I'm going to tell you something that most doctors don't know. So you're going to become very educated, Mr. Jacob. The neurochemistry pathways which carry the message of acute pain are different than neurochemistry pathways which carry the message of chronic pain. They use different neurosynaptic transmitters. They respond differently to different medicines. And if a patient is misdiagnosed, then you're using the wrong medicine. You have to know what kind of tissue is damaged. Damage to nerve tissue doesn't respond to narcotics. Damage to inflammation doesn't respond to narcotics. Nerve tissue needs anticonvulsants. Inflammation needs anti-inflammatory drugs. So until you have the proper diagnosis, you don't know the kind of tissue that you're trying to treat. And it's a very important concept. And when our patients get accurately treated, we have documented cases, 89% reduction in the use of narcotic medication and opioids, 85% reduction in sleeping medicines and tranquilizers, and 45% reduction in doctor visits, with cost savings between $20,000 to $175,000 over the course of the patient's lifetime. So good medicine is accurate medicine, and that really makes a difference.
Yeah, so interesting. I mean, it just makes sense when you sort of lay it out the way that you do, and you're able to take these complex issues, Dr. Hendler, and sort of make them simple for the everyday man. The idea that this acute pain and chronic pain are 2 totally different things. They have different pathways, but yet we're treating them all the same in a lot of cases, and that's the problem, right?
It's erroneous, exactly. And that's the major source, is the physicians are treating chronic pain like acute pain using narcotics. And the patient comes in the office with a broken leg, and they're treating him symptomatically. So I'll give you a narcotic for the pain in the leg. Wait a second, how about setting my leg so the leg heals?
That's incredible when you mention it and talk about it like that. It's going to resonate for so many people. Now, I'm going to throw a little ringer in here for you, Dr. Hendler. I think you can handle it. You played lacrosse at Princeton.
Yeah.
What can you take from playing a varsity sport, from a team sport, that you've been able to take over into your entrepreneurial journey, building your company, Mensana Clinic Diagnostics with your team? What do you take from sports as an analogy to entrepreneurship as an analogy, and what can you bring to the viewers to share with them about what you learned playing sports lacrosse at Princeton?
That's an easy question. You have to build a team. And you build a team by respecting all the team members, listening to their input, and synthesizing it and getting buy-in so they all agree that the pathway you're choosing is the appropriate pathway. I'm not arrogant enough to think I know everything there is in the world. And I'm going to tell you, I really sincerely mean this. I've never met a person from whom I have not been able to learn something. I really mean that. I mean, I couldn't be more sincere about that. So I always take people's input and synthesize it and integrate it. And when I had my clinic, I always met with my staff 15 minutes a week, every staff member, 15 minutes a week, and had staff meetings 1 hour a week for the entire staff. And my turnover in 29 years, no turnover of staff. Does that tell you the answer?
Yeah, that's a great answer. It's a great learning experience for the entrepreneurs watching the show. Now, Dr. Hendler, we do have some younger entrepreneurs that watch the show, of course, and maybe they're having a tough time in their entrepreneurial journey. Maybe they're hitting a roadblock, a pothole, maybe they can't get through the wall. Maybe you could share some insight from your experience to the younger entrepreneurs watching the show about what it takes to get through a tough time and come out the other side, being actually very happy that you've gone through the tough time and came through it in a powerful way.
Believe in yourself. That's it. Because if you don't believe in yourself, no one else is going to believe in you. And be able to prove everything you say. Nothing will destroy credibility more than you advancing a notion and then be unable to document it. They used to call it selling vaporware. Remember that?
Yes.
In the .com era of the 1990s.
That's incredible. I mean, it's just so poignant what you just mentioned, to believe in yourself. I'm going to bring you back on the show. I mean, there's so much to unpack here. The entire world needs your testing. Certainly the people that are misdiagnosed, because they're going down this hole that perhaps they're not going to be able to get out of unless they correct the path. And that's one thing that your tests can do. We're going to put the links to all your tests in the interview. Of course, you've got the pain validity test, the diagnostic test, of course, and the headache diagnostic test. And I'm sure there's going to be more on the drawing board as we go along, right?
Well, just to give you an idea, there are 11 different verticals that can find the test useful. Paradoxical as it may seem, I finished an article with Tom Emmerich, who was vice president of Walmart, about the need for centers of excellence. The bottom line is the tests can be used to save workers' compensation insurance carriers 54% on their workers' compensation bill. That's been published in the Self-Insurer. And the tests can be used to increase attorney income 300% and physician income 35%. And the test can be used to help a patient get well. So, and it can be used in the pharmaceutical industry to establish a diagnosis by eliminating inter-rater reliability issues, because I've done a lot of phase 3 studies for pharmaceuticals. So the answer is very simple. If you want the truth and you're not afraid of the truth, the test will give you the truth and you can apply it wherever you need to apply it.
So good, Dr. Hendler. I love it so much. I've learned about Bayesian logic today and the difference between acute pain and chronic pain and the way in which those paths are much different and need to be treated in a different way. And of course, about what you're doing with all the testing at Mensana Clinic Diagnostics. I mean, this has been a great interview. I've kept you over, my apologies, but I'll have to bring you back on the show when we have more time. I'm going to book an hour and let the television stations and everybody know we're going to do an hour with Dr. Hendler. So I wanted to thank you so much for coming on the .com magazine Entrepreneur Spotlight Series today. This has been a remarkable interview.
Thank you very much for having me, Mr. Jacob.